Hey gang, Jamie Dreyer here with Overhaul Training, and in this video I'm going to talk to you about ulnar nerve entrapment, also known as cubital or ulnar tunnel syndrome. First off, we're going to discuss where it is, then what it is, what causes it, and lastly, what you can do for it. So first, let's get a picture of where the ulnar nerve actually is. It comes out of your lower cervical spine and off to the side, and then it goes between your scalenes, which are these long stringy muscles on the side of your neck there. Then it comes behind your collarbone, through the armpit, wraps around to the back of the tricep, makes its way around the elbow. Quick side note, when you smash your funny bone, you're actually smashing your ulnar nerve against the elbow. Not funny. Then from there, it goes through the cubital tunnel, which is essentially like a band of fascia right there. Now at this point, once it goes through the tunnel, it's actually behind the flexor muscles in your forearm. And once it gets down about midway over here, it pops out between those muscles, specifically the flexor carpi ulnaris. Then it comes around the back side of your lower forearm, and then it makes its way to the fourth and fifth fingers. All right? So that's where the ulnar nerve is. Now, what is the entrapment? So entrapment is essentially, at any point along this route, the nerve is either going to be compressed or it's going to get snagged. And I kind of like to use the metaphor of a garden hose, right? So your nerve needs to have a signal flowing through it so it can tell the muscles what to do and then have signal come back to the brain. Kind of like with the garden hose, you want water to flow through it so you can bring life to the plants. Now, if at any point you step on the garden hose and cut off the water supply, no bueno. Or if you're kind of like dragging it through the backyard between the flower bed and the rocks and then the fence, eventually at some point it might get snagged on like some type of a sharp edge and not be able to flow smoothly. And if you continue to pull on it taut, then it's going to start to cut off some of the water supply that way. And the same exact thing happens with your nerve. If it gets snagged for any reason, it's going to cut off some of the nerve signal. So what could cause that? Several different things. First of all, you could have had some type of a direct injury, like some type of a blow or a hit that causes old scar tissue and an injury that way. You could have fractured the elbow and it heals wrong. You could have compression, such as if you're a cyclist leaning on handlebars. You're actually leaning, pressing the bones of your hand up against the handlebars with the nerve in between getting smushed. Or you could sleep on your side all the time in the same kind of position, putting pressure on that ulnar nerve and getting things jammed up that way. Now, the biggest way that people have problems with this type of an issue is if they work with their hands. And the reason being is we talked how the nerve comes through the forearm flexors there. If you're constantly working with tools and engaging those flexors, or if you are like a manual therapist, chiropractor, physical therapist, massage therapist, and you're always working with them on patients, then these muscles are going to get really tight, and as they do, they increase the pressure on the nerve. And that's one of the big reasons that people have issues here. So, now that we got a good understanding about what it is, what can we do for it? As always, I like to start off with my 4-step process to fixing overuse injuries. Let's give a quick recap, shall we? All right, here we go. Step 1 is identify offending activity. Step 2 is stop or reduce the activity if you can. Step 3 is to release trigger points, and in this case, because it's a nerve, we're also going to want to release any adhesions that are stopping the nerve from gliding properly. And then step 4 is to strengthen the weak muscles. So here we go. Step 1, identify the offending activity. You can do this very easily by looking at some of the causes that I mentioned earlier. Injury, elbow fracture, compression because of the way you sleep, or maybe a sport that you do, such as cycling, or the type of work that you do every day, whether it's working with tools or working on human beings. These are going to be your issues that you need to address. Step 2, stop or reduce them. If you can't, because your livelihood depends on it, you're going to have to double down on step 3, which is releasing the trigger points. We could do this many ways. We've discussed these in many different videos before. You can use the stick to free up the trigger points and start to release the forearm flexors that are overworked. Get acupuncture, see a massage therapist, any number of things. Once you start to get those muscles to relax, then you're going to want to go ahead and do a stretch. Really simple, nothing fancy. Just regain that length back in the muscles. Once you've stretched it, you're now going to want to move on to neural glides. This is the part that is worthy of a whole other blog post in and of itself because it's something that most people don't have any experience with. I've got about 4 or 5 neural glides that I recommend. Essentially what you're trying to do is you're trying to take the nerve in its path, and if there's any stuck spots, you're trying to do these exercises that gently free it up and break those adhesions up so it can move more freely, kind of like when you're dragging the hose through the garden, all right? Because this is worthy of a post unto itself, I actually did a post unto itself for neural glides. There should be a link popping up anytime before the end of this video is up. So you're going to go ahead and just click that link. When you make it there, there's also a free guide that you can download with all the exercises, so you've got a reference guide. But we'll get to that in a second. So for now that you've freed up all this tissue, that's the end of step 3. The next and last thing you need to do is strengthen the weak muscles. Piece of cake, right? So our flexors are the ones that are overworked, so we need to strengthen the extensors to balance out the structure. You can do that with a flex bar, and you're going to do the same exact exercise we've done in the past for tennis elbow, right? So you're coming in, you're eccentrically unloading that muscle, and that's going to strengthen the extensors. You can also use a dumbbell, I'm going to pretend this is a dumbbell, and just do some wrist extensions. It's that easy. There you go. That's how you're going to address your ulnar nerve entrapment. My name is Jamie Dreyer with Overhaul Training. Hopefully this video has been helpful for you. If you liked it, then do me a favor and like it. And then go ahead and click the link, head over to check out the neural glides for the ulnar nerve. I'll see you in the next video.